Assalamualaikum. Hi, my name is Nurul Ainin binti Roslan, and I'm going to present the case-based learning on altered mental status. So, question number 5. What is Glasgow Coma Scale? Based on the definition from World Health Organization (WHO), it is defined as a scale used to objectively describe the extent of impaired consciousness in all types of acute, medical, and trauma patients. So, question number 6 is describe how assessment of GCS should be done. This is the table that shows the assessment of GCS. So it begins with the eye and then proceed with the motor and verbal response. Total marks for eyes is 4, total marks for motor is 6, and total marks for verbal response is 5. So this is a picture that shows eye opening and also motor response. If patients spontaneously open their eyes, we can put it as 4. If patient to unable to open their eyes or his eyes is closed, we can stimulate a verbal response. Ask patient to open their eyes, and then if patient open their eyes upon to speech, we can put it as 3. If not, then we can try to elicit pain to the patient, especially at the supraorbital or at the sternum. And if patient open their eyes upon pain, we put it as 2, and if no response, we put it as 1. For motor response, if patient can obey commands, we can put it as 6. And if patient is not fully awake, we can put as pain stimuli at the supraorbital region or at the sternum. If patient react to it by moving towards the pain and try to remove the pain stimuli, then it is considered localized. If patient will just withdraw from the pain, it is considered 4. And if patient shows abnormal flexor response, especially flexion at the elbow and wrist, and in the corticate position, it is considered 3. And if patient in the cerebrate or extension of elbow, it is considered 2. And if no response, we can put it as 1. And this is a verbal response. Um, we ask patient the 3 question: what is his or her name, what year is this, and where is he or she now. If she can answer it appropriately, then it is considered oriented, we put it as 5. And if patient are confused and giving the wrong answer, then we can put it as 4. If patient doesn't answer and use an inappropriate words, we put it as 3. And if patient just scream, groan, or moan without intelligible words, we can put it as 2. And if no response, we put it as 1. What is the significance of measuring temperature in this patient? So we can divide it into hyperthermia and hypothermia. If patient is having an increase in temperature or febrile, we can say that it can be due to infection like meningitis, encephalitis, burn abscess, subdural or epidural hypema, or it can be due to poisoning or alcohol withdrawal. If the patient is hypothermia, mean reduced in temperature, it can be due to drug overdose, sepsis, cold exposure, or low body hormone level like hypothyroid. What are the significance of other vital signs? So, vital signs that we can check is pulse rate, blood pressure, and respiratory rate. If the patient is tachycardia, it can be due to patient having airway obstruction, hypovolemia, or arrhythmia like supraventricular tachycardia or ventricular tachycardia. For bradycardia, you can say that patient could having hypoxia, hypothyroidism, or increased SEP. For blood pressure, if the patient is hypertension, you can consider it having increased ICP, hypertensive encephalopathy, and cerebral hemorrhage. Then, if hypotension, it can be due to hypoxia, shock, poisoning, or internal bleeding. And for respiratory rate, a patient with tachypnea can be due to diabetic ketoacidosis, sepsis, or hypoxia. And if patient is bradypnea, meaning a low respiratory rate, can be due to toxic ingestion. So this is a synthetic stroke scale. Synthetic stroke scale can be assessed by assessing three things. First is facial droop, two is arm drift, and abnormal speech. So if patient is, we see that patient have asymmetrical face, we can ask patient, can you smile or show your teeth? Preferably to show their teeth, so that we can see which side of face does not move as well as the other side of drooping. So if the face is drooping on the other side, it is considered positive. For arm drift, we ask the patient to close their eyes and hold both arms out for 10 seconds. If one of the arm is drift down compared to the other, it is considered positive or abnormal. And the third one is abnormal speech. We have the patient to repeat after what we said, like can you teach us old dog new tricks, or in Malay, bangun pagi gosok gigi. If the patient shows slurred words or using the wrong words or unable to speak, then it is positive for abnormal speech. Then the interpretation is any of these signs is abnormal, so the probability of a stroke is 72%. This is the mnemonic to recognize stroke using FAST: face, arm, speech, and time. So any of this, if patient came with any of the sign, facial drooping or asymmetrically facial expression, arm drift down, uh, or speech, slurred speech sounds strange, and then it's time for them to call 999 and then ask for help. Thank you.